Welcome to Coffee Chats with Klaas. Hi, I'm Malia Cuevas with Klaas Financial. And today I'm here with Eric Schwartz, a certified financial planner, to discuss a topic on the minds of many of our clients, Medicare. Eric, can you give us a high-level overview of Medicare?
Sure. Medicare is the national health care program administered by the federal government for eligible individuals aged 65 and up, as well as those with certain disabilities or specific diseases, such as ALS or end-stage renal disease. It is funded by payroll taxes and premiums paid by those receiving coverage.
What does Medicare cover?
Medicare is divided into different parts to cover a variety of different healthcare services, subject to a deductible. Medicare's Part A and B make up what is known as Original Medicare. Part A covers inpatient hospital care, skilled nursing facility care, hospice, and home health care. There's no premium for Part A, assuming that a Medicare recipient or their spouse has worked and paid payroll taxes for at least 10 years. Medicare Part B covers outpatient services, so think of doctor's visits, preventive care, medical equipment, and mental health care. Part B does require a monthly premium, which adjusts every year and currently stands at $170.10 per person per month. The Part B premium does increase for higher individuals under the Income-Related Monthly Adjustment Amount, or IRMA.
Does Original Medicare cover all of the healthcare needs of Medicare beneficiaries?
Unfortunately not. There are some additional types of coverage for individuals to consider. Medicare Part D provides prescription drug coverage to Medicare beneficiaries for an additional premium. Like Part B, the Part D premium increases for higher income earners under IRMA. A Medicare supplement policy, also known as a Medigap policy, is a supplemental insurance policy sold by private companies to cover costs not covered by Original Medicare, such as deductibles, copays, and coinsurance. While supplemental policies are offered by private insurance companies, they are standardized to some extent, and they must meet certain criteria and provide minimum coverage set forth by Medicare. For that reason, it's really important to pay attention to the cost of plans offered by different insurance companies. It's also important to note that you must have Medicare Part A and Part B to enroll in a Medicare supplement plan. And a Medicare supplement plan requires an additional premium over and above the Part B or Part D premium.
I'm sure many people have heard about Medicare Advantage plans. What should individuals know about those?
That's a great question. Medicare Advantage plans, sometimes called Medicare Part C, have become increasingly popular, so it's important to understand what makes them different from Original Medicare. Medicare Advantage plans are offered by private insurance companies, and they bundle the coverages available under Parts A and B, which may also include Part D. Some Advantage plans even include dental and vision coverage, both of which are not covered by Original Medicare. While Advantage plans often charge lower premiums than Medicare supplement policies, they often have higher out-of-pocket costs and can be less flexible than a supplemental policy. For example, Advantage plans may only cover providers in a certain network. All the same, Medicare Advantage plans can work very well for some people, and for others, a supplement plan is a better fit. It's really about finding the right plan for your specific situation and your needs.
Are there any important services that Medicare does not cover?
Yes, that's a very important point. As I mentioned earlier, Medicare does not cover dental or vision services. It also does not cover the cost of purchasing or fitting hearing aids. Another glaring omission from coverage under Medicare is coverage for long-term care expenses. While Medicare will cover the cost of a relatively short stay in a skilled nursing facility, it will not cover the cost of prolonged custodial care in a nursing facility. Costs for long-term care are largely covered by two sources: private long-term care insurance policies and out-of-pocket payments from patients. In the case of low-income individuals, Medicaid, not to be confused with Medicare, does offer financial assistance for qualified persons for long-term care expenses.
To wrap up today, what is one piece of advice you'd give to individuals preparing to enroll in Medicare?
We encourage all of our clients to work with an independent health insurance professional. As folks approach age 65, they are inundated with marketing materials from health insurance companies, and it can all become very overwhelming. An independent insurance agent can help you cut through the noise and find a plan that fits your needs.
Thanks so much for clarifying the world of Medicare for our listeners.
You're welcome. Thanks for joining us for Coffee Chats with Klaas.